Let's do an initial consultation.
Sure. So during the first appointment here at Harmony, beforehand we'll collect any records from other veterinarians that might be pertinent to the reason for your visit here. The first exam runs for about an hour and a half. We probably spend the first 20 to 30 minutes just talking. I'll take a very complete history of your pet, asking questions about their dietary habits, their stool and urination, any past illnesses, behavior, if they get along well with other animals and people, or if they're more shy or timid. I'll ask questions about your animal's propensity to lay in the sun or lie on the cool tile. That helps me get a sense of if they're an animal that likes the heat, that's always cold and always wanting to get warm. I will ask about any recent or past changes in their life that could have been disrupting, if they come from a shelter situation or have been rehomed frequently. And after we've discussed all those things, I'll move on to doing my physical exam. I start off with, I always like to go pretty slowly and let the animal listen to my voice, get used to me being in the room, so it's a very low stress event. I will check my patient's ears, see if they're warm or cool, smell for any signs of yeast or any infection in the ears. I will touch the paws and feel for any heat there, and look at their coat very closely. Look for signs of dander or oil or any red excoriations or scratches. I will take note of their nails, how long they are, what condition they're in. I then always look at the tongue, and we'll show you here on Tula. We open her mouth, I'll look at the tongue, I'll look for the color of the tongue, if there's any coating on the tongue. Does it have white, sort of slimy coating, or is it moist and clear? I then will scan the animal for signs of heat in their back and along their limbs.
And you could feel the heat?
Mm-hmm. Yeah, so...
what's that telling you?
So it tells me that there's inflammation or stagnation in an area. So say... or if I feel a very cold area, I might know that there is not enough blood flow going to that area. It gives me insight into how my patient is doing. Unfortunately, our pets can't talk, so it really puts the onus on me to do a very thorough physical exam, really get my hands on my patients in a kind and gentle way, and hear what they're telling me with their nonverbal communication.
If this was my cat, how different is the
exam? Yeah, so cats really depends on how much they tolerate being messed with. My exam will be very similar to what I'm doing here with Tula now, just gently rubbing on them. If they're a playful young cat, I might play with them and then do like a sneaky approach to say, feeling their lymph nodes, which I'm doing in Tula right now. I'm feeling her cervical lymph nodes. And so if it's a kitty, I might be like, oh, key, and rub there in a non-invasive way, sort of find out what I need to know. I always, on all my patients, cats included, will take a pulse. It's very important in the traditional Chinese exam to do a pulse assessment. It helps with my diagnosis, and the pulse that I use is the femoral artery. So on Tula here, or on any animal, I will run my hands in the inside of her thigh. I can feel her pulse. It is toned. It's what I would call a little bit choppy, which can be a sign of stagnation and or heat in the body. So I will feel the pulse. Run my hands down the other place we can feel lymph nodes in the body, which is in the back of the knee here, or in the popliteal fossa. I'll glance at the patient's bum and look at make sure it's not red or irritated, and then I will sit with them for a couple minutes and just put my hands on them and see what they tell me about where they want me to put my hands. And I use all that information in conjunction with regular respiratory rate. I'll listen to the heart, make sure there's no murmur present, do a more Western type exam, but in a very non-invasive manner. And after that, my treatment protocol is sort of based on what I find during the examination and with what my client is coming in telling me about their pet.